John Lazarus, Emergency Room Director here at AdventHealth Fish Memorial. So my experience has been very positive, right from the onset, from our pre-planning sessions and meetings that we've had, very engaging, very strategic, and from an execution plan of kind of rolling out our project plan of all the elements that we will need to incorporate to be successful. So highly engaging, very collaborative. It's been a great partnership. So just like with many healthcare organizations, we found ourselves dealing with nursing burnout, nursing turnover, and we really needed to take a look at what we need to incorporate to stabilize our workforce, particularly our nursing workforce. So as we took a look at all of the workload intensity items that was requiring our nurses to provide at the bedside, we realized that they needed more help and more support, and incorporating a virtual nurse program allowed us to do that. So particularly in our emergency department, virtual nursing has been very well received by our bedside nurses. We asked our bedside nurses what were the top items that they prioritized that could help decrease workload intensity. The top 3 items that our bedside nurses told us is, John, leadership team, we need help with med-rec. We spend a lot of time documenting all of our patients' medications upon arrival to the emergency department. Some of our nurses were taking 30 to 45 minutes per patient to document all of that. So that was number 1 that they said they would like help with, and that's exactly what our virtual nurse is doing. The other 2 items that they really wanted help with is preferred pharmacy and just validating that allergies were always accurate in the electronic medical record. And the 3rd item was social and medical history. A lot of times as ER nurses, we'll find out why you're here, and if it's for a cardiac reason, we'll find out all the cardiac history you have. But there may be other history, other surgical history that may be important to know that can help for us to provide better care for you, knowing your pre-existing medical and surgical history. So our virtual nurses help incorporate and gather that information for us. This was a very new project for us, so even when myself and our team conceptualized this, we knew that we were going to do certain elements that would help support our team, but it's been extremely well received by our bedside nurses. They have really said that this has been really helpful and supportive to them in providing care. This allows our nurses to spend more quality time with patients because somebody else is helping with the other elements such as documentation, that allows our team to spend more time with their patients. They actually really appreciate it. They say that the virtual nurses are extremely nice, helpful. They set expectations on what to anticipate and what to expect next, and just been extremely helpful. We've actually had some patients that have come back and asked, were they going to be in a room where we had virtual nursing? Because today we are piloting virtual nursing in 14 out of our 37 beds. So if there's a patient that has experienced virtual nursing and then is in one of the other rooms, they actually ask if they would and can have a virtual nurse as their second nurse. Yes, absolutely. It definitely has been time saver for our nursing team. Our nursing team has been extremely positive with this level of support that they're getting. So yes, I would absolutely support the rollout of virtual nursing.